therapeutic sense, that is what you're listening to music for. It creates that sense of, I don't know, like the feeling of I may possibly love or being in love, and then the chemicals or the neurotransmitters responsible for that. So these kind of experiences can be had, like when you exercise, you feel, you know, certain chemicals are produced, and that makes you feel a certain way. Like, I don't know, finding some space in that through music, trying to connect with the subconscious mind, subconscious thoughts, subconscious patterns, and then making some connection through the music, which could be listening or participatory, like where you're like playing with me, or yeah, like I said. So it's like certain tasks are performed, certain things are, you know, conversations, or certain particular tasks are given, and then the brain is scanned during that process. And then there's also the brain on music. So listening, I think that person who they were like doing this experiment was listening to salsa or something like this, and the whole brain was another area I'm interested in. So like dementia, Parkinson's, Alzheimer's. I work with people who have cancer, children, especially children with cancer, depression, and during the lockdown, a lot of, you know, anxiety, people struggling with anxiety and depression. Yeah, so in that spectrum, in that space of self-worth, empowerment, and you know, self-belief and confidence, in those categories of that person's life, there will be change, but it doesn't have to be about what.
Welcome to my channel, Digital Wellness, Kamal Singh. It is a great pleasure to be talking to you today.
Same here.
Kamal, you know, I'm so deeply connected to this topic of music therapy, because we at Digital Wellness and DigiNxtHlt are doing a lot of work, you know, bringing technology into music therapy. And, you know, this is a question that I cannot stop asking. I've, in fact, asked a lot of them who come onto my channel, and I still never get satisfied, and I do not hesitate to keep asking people the same question. So I pose this first question to you: is music therapy a buzzword, or is it real, Kamal?
Yeah, yes, it is real. Maybe that will be the best answer to give you. Yes, it is real, but I also know, I mean, in the sense, this whole buzzword thing is also an important question to ask, right? Because like so many things happen in the, like, with the name music therapy, or using these terms, like people do a lot of things. So yeah, there are a lot of people who do various kinds of things, and I don't think everything that is claimed to be music therapy is like based in something that is researched, or even like clinical, for that matter. I mean, yeah, but it is, I mean, in the sense, like, I'm not trying to say what I do is real, but like I've studied, and it's kind of based in research and ongoing research. It's not just like somebody's notions, or somebody's desire to work with music, or my own personal desire because I'm a musician or because I like music. It's not based in that. It's based in research, and also it's based on ongoing, like, clarity, like trying to understand this better, trying to figure it out, trying to understand what is the best way to work, or what are the things that we should avoid, and what are the approaches that will make sense, and what are the approaches that actually benefit the people you're working with. Yeah.
So, you know, this is something which most of the other speakers on this topic have also said, that yes, it is real, and this is something that we do work on a day-to-day basis. So, you know, that kind of you know, justifies the path that we are embarking at Digital Wellness and DigiNxtHlt. So, you know, the next question really is, because we all know that listening to music, no matter what kind of music, is really therapeutic, right?
Yeah.
You know, the question that always lingers in my mind is, you know, what is the relationship that these moods and emotions, right, that one has on music, and therefore the brain?
Yeah. So I think, like, I'm not very academic in my approach, or I don't pay too many attentions to the science-based details. Mostly, I'm just doing what I have to do, and I kind of understand what I'm supposed to achieve and what I'm looking to do. So I don't really break it down into the scientific part of it, but I do know a few things. For example, like these neurotransmitters like dopamine, serotonin. In a therapeutic sense, that is what you're listening to music for. It creates that sense of, I don't know, like the feeling of I may possibly love or being in love, and then the chemicals or the neurotransmitters responsible for that. So these kind of experiences can be had. Like when you exercise, you feel, certain chemicals are produced, and that makes you feel a certain way, like good or like happy or reward, like accomplished that you did something. So these things also can happen with music in a therapeutic sense, which is why a lot of people listen to music first of all. And like when they talk about music, it's all very, like, you're describing a lot of emotions, right? Most of the time when you talk about your experience with music, the descriptions will most likely be very emotional, or like kind of recollecting memories, or like past memories coming in, certain sensations or feelings, or thoughts. So it is connected like that. I'm losing my train of thought, but what was I trying to say? Yeah. So basically, there is a connection between the brain and music. Very, I think it's kind of significant, because I've also seen some. You can look these up on the internet. Um, Studies where like people have done brain scans. I think, is it called brain scans when
Right.
somebody is listening to music? So it's like certain tasks are performed, certain things are, conversations, or particular tasks are given, and then the brain is scanned during that process. And then there's also the brain on music. So listening, I think that person who they were like doing this experiment was listening to salsa or something like this, and the whole brain was, like, because it's a scan, you can see everything activated, right? There's a lot of, everything lights up, and there are different colors and things like that. So yeah, I guess they're just trying to show you scientifically with proof how the brain responds to music. So there's a lot of response that the brain has to music. And but primarily in the space I'm working in is like your subconscious. So I'm not really focusing too much on the therapeutic things that you were talking about, where it's about feeling good or like feeling relaxed, or energy or excitement. I'm not really focusing on those areas too much. Well, actually, I don't ever engage with that area. Mostly I'm just like looking at subconscious, uh, like, I don't know, finding some space in that, through music, trying to connect with the subconscious mind, subconscious thoughts, subconscious patterns, and then making some connection through the music, which could be listening or participatory, like where you're like playing with me, or yeah, like I said, listening and like interacting. And then, because the brain responds to music like that, and especially the subcortex, the lower part of your brain, deeper part of your brain, or I'm not really sure what the correct word is, but it's the subcortex, right? The cerebral cortex and the subcortex. So yeah, I try to find the connection through that, and then work using, sometimes you speak, sometimes you don't speak, sometimes it's just like music interactions, and through that we are able to do things together or explore certain areas.
Right. You said about subconscious, that's your,
Mm.
that's the method that you use. So, just taking on that, Kamal, is there a pattern or a methodology, if I may call it, that you follow for treating patients?
Yeah, I do follow a methodology, but the methodology is not something that's based on the subconscious mind. It's kind of like I'm working, so my framework is mostly like building trust, trying to build a relationship, trying to create a new relationship that is based in trust. So then the safety, right? Trying to create that safe space, and a relationship that is based in this interaction, which is based in music. So that is the framework. Then from there is what I start exploring. Like I start exploring different things based on that established relationship. And it's also like, if you ask me about my framework or methodology, it is like, yeah, so basically creating a secure space, creating a relationship, like a healthy relationship based in this in music, which is primarily you're focusing on not just like connections, you're focusing on building a relationship that is little deeper than that. And but you're not really, it's not something that I can explain easily. So once you have the relationship, then I'm also thinking of empowerment, and you know, these are the things I'm thinking of or even working towards. So that is my method or framework.
Right. So, I have a curious question, but before that, I want to ask, uh, what is the spectrum of areas of disorders that you normally address?
Mostly it has been special needs, because that was accepted, or at least somehow I think in the last, well, I'm working now for the last 7 years, but in the beginning, when I just started, it was very exciting the time, but then nothing was really happening because music therapy is still new, and at that time it was very new. And but somehow in special needs schools and people working with children with autism or all the other special needs are kind of familiar with this possibility of intervention through music therapy. They've either heard about it, or they read about it, or they went when they went abroad, they saw this being used. And so like there was a lot of opportunities in special needs. It was not something I was very interested in, but like, so that was typically what I was doing initially, special needs, which is, it's not like I don't like to work in that space. It's just I have, like, I'd like to work in many more areas. So eventually over time I've been able to work with people with Alzheimer's, another area I'm interested in. So like dementia, Parkinson's, Alzheimer's. I work with people who have cancer, children, especially children with cancer, depression, and during the lockdown, a lot of anxiety, people struggling with anxiety and depression. I also work with people dealing with trauma and many other kind of mental health issues. Yeah.
Right. So,
These are mostly like regular. Okay, I don't want to use that word regular, but like, so just did it every people like you and I, right, dealing with different things. So that's also an area which I'm very interested in, because you can work very well, or it can be very effective
right,
in like trauma, abuse, depression,
right.
and it's not popular, right? People don't know about it much, like the effect of music therapy in those areas. So but it's getting better.
Right. So, then since you handle a wide range of spectrum, right? So, especially, special needs children, while they, of course, it's known that they respond to music, they respond, and they really, that's a biggest, what do I say, distraction tool for them, right? uh, that case, I get back to my methodology question, right? Is there a pattern that you follow, that for a child with a special need versus a person who's probably mentally depressed? Because you also said that during the lockdown, there were a lot of people who needed the attention, right? So is there a different way that you handle each of these spectrum, that you, because I'm curious to know, you can't have a one size fits all for everybody, right?
Yeah. Yeah, so it's yeah, there's no pattern like that, or there is no clear like, okay, do this and do this. It's not like that, right? So like I told you before, my methodology is that. So like typically the only connecting factor is this, where you're first trying to build a relationship with the person, regardless of what it might be, right? Whether it's anxiety, depression, or special needs. What I've noticed is primarily, I first it's about building the relationship where there is trust, and then from there we explore. Because like, if you're going to explore subconscious things or like patterns that exist for certain reasons or whatever it might be, you can't just like, what I've realized is, to get to a point where this intervention is working, there needs to be a lot of trust. So like, and then once that is established, it becomes very easy to explore these things, whether it's changing things, or whether it's realizing, or even just like trying to figure out some things, whatever it might be. It's like, without that relationship that is like safe and based in trust, it's not possible. So ultimately, that is the main method.
Then it comes to a point. So you actually create music on the spot, because I see so many guitars at your background, Kamal. So I'm sure you must
Yeah,
be.
there's a lot of improvised music, so we create music together. It could be
Okay.
that. Yeah,
Mm.
we also have. I also have listening activities where like the person is listening to certain, but it's not listening to music like in terms of listening to this song. That can also be part of it. Sometimes we have them listening to familiar songs, singing familiar songs. Then there can be songwriting where you're writing songs to process different situations or different things that the person is struggling with or dealing with. But in the initial part of the work is where you're just listening to music that is uh, kind of creating this sense of either some sense of safety or some like, or if I want them to explore, then that the music is kind of gearing towards exploration and yeah. And if you're creating music together, then it's like, again, it's spontaneous, right? So whatever you not so you maybe that's an important thing to remember. So you don't have to be trained in music, or you don't have to be like somebody who plays a particular instrument. That's not necessary. And actually it's better you don't have any formal musical training, because then we can do what we need to do faster. With somebody who is trained in music and is familiar with music, it gets more complex because you have to undo a lot of things to come to this space.
Okay. Okay.
Yeah.
So it's like you explore together.
Yeah,
And
totally.
yeah.
Yes. Yeah.
So, this is a very interesting piece, because you mentioned about activity, because that's one of the key things, like, especially for the brain, kind
Mm.
of calms down. So that's a very good, thing that you spoke about, how you build activities together. Uh, you know, since it is so deeply involved, Kamal, because either creating music together, or you are going to play bits of music or activity or whatever. So, does music therapy require a face-to-face interaction between the therapist and the participant, or how do you typically?
Yeah, sometimes it is very it I think there's no way around it. Sometimes you just have to be in front of that person, right? Sometimes there's certain scenarios that demand that. But initially I was kind of like, I never ever thought of this, like having this Zoom call now, for example, was not something that was part of my thought process even. And so initially all my sessions were like meeting the person face to face, doing it right there and then, like with the person in the same room, or like face to face, like you said. That was all I was doing, right? And then this thing happened, this great corona of the world. And during that time I had to reconsider this thing that I had with, like digital or what, online or Zoom or whatever it might be. So then I started exploring that. So that's when I started using a lot more of the listening techniques, right? So this listening activities. And so you don't have to be face to face. Well, in a way I encourage them to put on the camera at least, so there is some sense of like, seeing the person's face at least. But yeah, many of the people I worked with didn't want to put on the camera even. So even that is fine. So you don't have to be face to face to make things work.
Right. So you're
During the
saying,
lockdown, especially, a lot of people I worked with uh, didn't want to put on the camera.
yeah, yeah, yeah. That's a thing. But so you are saying that online is also a medium now. At least it
Well,
became.
yeah, it's a very effective medium. I mean, contrary. What I don't know what I'm trying to say. So as opposed to what I thought, new word, it worked quite well.
Right.
Yeah.
So, Kamal, especially in India, this topic of music therapy is still, like you also mentioned, at a very, very infancy stage. I know in the Western world, it is like a serious career. I've spoken
Yeah.
to a few of them in the past.
Okay.
They also said that, it's a 5-year course, right? In
Yeah.
India, it's still at an infancy stage.
Yes.
So, I'm curious what motivated you to take up this profession?
Mm. I heard about it long time ago, actually. Like when maybe around 2001 or two or something like this. During that time, I heard about it, and I was very curious. I mean, I've always been working with music. I used to work in a church also, and different, like, okay, so maybe the thought behind this was, like, I always had this feeling, or I was curious about this, the if I don't know whether power is the right word, but there is something with music, that is not just what I knew at that time, which is playing and singing and listening, right? It was not just that. Something in me, or like I knew that there's something more, much bigger than whatever I realized at that time, or whatever I could even think of at that time. I knew that there was something else, and I was on this thing of like, what is that thing? I'm sure there is something, and is there a way to figure it out? Does somebody know it, or are there people who know it and are using it? There was this idea was very strong in my mind, and so I was just reading here and there, whatever, and I came across this thing called music therapy, and that then I, obviously it's like this very excitable thing for me at the time. So I thought maybe there is some magical thing in this music, that can, and I think I used to think that music could I mean, literally heal or like cure, those kind of things. Very like fantasy and excitement.
Mm.
But not that I got disappointed. I just found out more about it, and then I realized what it is, right? So I have a better understanding of it, and what I thought is true, because it is still amazing, and it is still, you still don't know how it works out, how things come together, and how do people struggling with so many difficult things, how does it all just fall in place eventually? That is still a mystery. So that, at least that has remained in one way. But in terms of this magical thing that you do and then something will happen, that that got cleared up very quickly, and I'm happy it got cleared up really quickly, because that made me also focus. I mean, since I understood that, and that was very clear to me, I was able to explore more areas,
Right.
and because I knew that, I think I kind of understood that I don't understand, but there's a process to follow, and then once you figure that out and you do that, it can work with anything. There is no restriction. You can work with somebody who can speak to you, and you can work with somebody who cannot say a single word to you. You can work with somebody who is very intelligent, and but dealing with certain things, and you can work with somebody whose brain is not functioning anymore, and you can still have a result at the end of it, and a result that you can't even conceive of.
Right, right. So, I know music therapy is definitely a very good answer. Definitely needs more exploration, especially in India. And I wish, with what we went through during the COVID-19 and the need for strengthening our mental strengths, it is all the more necessary that, my endeavor is to at least ensure a lot of them at least understand that there is something like this called the music therapy, and just
Mm.
not listening to music or making music is not music therapy. It is, much beyond that. uh, Before I kind of end this session
Yeah.
with you, Kamal, one of the things that I'm curious, this is a question from my side. How do you perceive uh, success, especially when you are dealing with the patient? He or she getting cured completely, or to you, what is success?
Mm. So, like, I think when I was using that word healing and cure in the beginning, so this idea of curing and healing, right, is also one of the hindrances. So we have this idea of what we think is the cure, or what we think is the solution to something that's there, and that is not really. So this kind of connects to your question in terms of, I think, like this idea of success, right? That success is also not about this thing that we think has to be the way things turn out, as opposed to success in terms of, I can see change is happening, I can see transformation, I can see that this person is more confident now, I can see that this person is being a lot more mindful, like they are not afraid of the things they used to be afraid of, or they're really afraid in the beginning of something, or this fear or anxiety is there, and I can slowly see that the way they talk about things is like of somebody who is not bothered by that, or they're able to handle things better, like talk. So for example, they might be talking about some boundaries, for example, right? Not able to draw boundaries which are helpful for them, and 4 5 sessions down the line you can see that they're not saying boundaries or anything like this, but you can see that they have decided with no fear, absolutely, and of any consequence, to put those boundaries in place and stick to it. So then there is, you I wouldn't say success as much as, okay, I can see that this is working. Nice. Okay, it is working now. This person is able to be more confident. This person is the self-esteem. I can see the self-value is right. Becoming, like, there was very low self-esteem and now it's not high or whatever. But because it's not a comparison, it's more like self-esteem seems to be showing itself here. Like that. Yeah. So that is more like this idea of success comes from, okay, it's working. I can see this change. I can see this person is willing to take those steps that they were afraid of taking before.
Right.
Literally making decisions like that they couldn't before.
So then you're saying you don't have a set that, you just need 2 sessions or 4 sessions. So it depends upon participant to participant.
Yeah. So typically, no, if 2 sessions will be too less. I think at least like around 4 or 5 sessions is when you start seeing, progress. Things are slowly changing. And,
Okay.
yeah, but it will change. Things will change. It will not change according to what everybody wants. It will change according to these ideas of empowerment,
Right.
ideas of self-worth,
Right.
ideas of safety, and ideas of, yeah. So in that spectrum, in that space of self-worth, empowerment, and self-belief and confidence, in those categories of that person's life, there will be change. But it doesn't have to be about what that person's parents think, or what that person's partner thinks, or what that person's school wants them to achieve. It's not connected to that.
Yeah.
It might, but it doesn't have to be.
Kamal, I of course have a lots and lots and lots of things to talk to you, but however, in the interest of time, I think you very well explained about how music therapy works and how it is really real, and I'm really looking forward uh, for hearing some more of your thoughts some other time. But
Yes.
thank you so much for this. Words of wisdom and also your point of view, because like I again said, I cannot stop talking about the subject because this is so close to the work
Yeah.
that we are doing. And thank you so much, Kamal. Looking forward for some exciting times together.
Yes, it was nice talking to you.
Thank you.
All right, bye.